Dr. Kihara, please allow me to share my screen. Hello? Hello, Dr. Kihara.
Okay, let me do that. Yes, you're the co-host now. You can go ahead.
Thank you. So can you see my screen?
It's loading. Yes, it's there. Thank you. Go ahead.
Okay. So we have said, basically, we are talking about school reopening in the COVID-19 era. And just as I started by saying that it is an unusual time, it is unprecedented. It's a moment that none of us has gone through before, but as Christians, I've started by saying that we believe that God is in control, and I'm talking about, that is in reference to Corinthians, 1 Corinthians chapter 10, verse 13, which says that whatever we go through, already God has made a way of escape. So for us, we have hope that even as our children go back to school, that indeed they are protected. God already saw that this was coming, and whatever we are going through is not something that's going to overwhelm us, that is given us that energy, that knowledge, that experience, and the discipline to be able to take care of our children in school. So this is what we are going to talk about today. So we'll go over a brief overview of what COVID-19 is in terms of what it does when one gets an infection. I'll also talk about the importance of having the children back in school during this pandemic, because they are parents, and I'm a parent. Many are asking, is school more important than health or life? But we realize that the benefits of keeping our young ones in school are higher than, they are more than the benefits of keeping them at home longer, like what has happened before. Then we'll also talk about the basic considerations that we are talking about UNICEF, the bodies that deal with health and children. We'll talk about UNICEF, we'll talk about WHO, and what our own Ministry of Health and Ministry of Education is putting into consideration as the children go back to school. And then we'll talk about what the parents, so we'll talk about the parents' checklist and the student checklist. So you look within yourself and see whether you have fulfilled those conditions that you need to have fulfilled before you can keep yourself safe in school. So I'll start by saying, as we have all heard in the media, we've heard from our parents, we've heard from our doctors, and all over, we've been hearing about COVID-19 in the year 2020. And we know that COVID-19 is an infection. So CO means coronavirus, V means virus, and D means disease. And 19 means that this virus was discovered in the year 2019. And we all know that it was first discovered in China. And we think it's a zoonotic illness that was spread from an animal, which is yet to be confirmed. Then we also know that this coronavirus belongs to a group of viruses that also cause what we know is known as common cold and the common influenza infections. But coronavirus itself causes what we call severe acute respiratory syndrome. That means it infects your respiratory system and causes issues with breathing and makes people very sick. And when it is serious, it can actually cause death. The main symptoms of COVID-19, as we have been told before, is that we have a cough, there's a running nose, there are breathing difficulties. Because the main site of infection is the lungs, and usually it destroys the lungs. So when the lungs are destroyed to a critical point, then one develops difficulty in breathing. And when it is so serious, that's why we find some people even end up in the ICU. Other symptoms, there are many other subtle symptoms that COVID-19 can cause. So someone might have things like headache, they might have joint pains, one might have loss of taste or loss of smell, and many other conditions that one might experience even after they've been declared COVID-19 negative. The infection is only confirmed by testing. Just as we have said there above, that this virus belongs to the same group of viruses that will cause common cold and flu. So we realize these symptoms like cough, running nose, and difficulty in breathing can be caused by many other infections. It can be viral or bacterial. So it means when one has been identified with these symptoms, then we can only firmly say that they have COVID-19 by performing a lab test. COVID-19 is spread by respiratory droplets, and that is if an individual gets into contact with these respiratory droplets that have originated from an infected person. So these droplets are spread through either cough, sneezing. They can also rest on surfaces, so that if one gets into contact with the surfaces that have been infected, then can get an infection. The people who are at risk is basically the all age groups. All age groups can be affected by COVID-19, but we know that there are that population of people that are more at risk. And here we are talking about extreme of age, which is in this case is people who are more than 65 years. And we have people who have underlying medical conditions. And those underlying medical conditions are like diabetes, hypertension. We have what we call chronic lung disease. We have people with the conditions that make them have low immunity. And in this case, we are talking about cancer. We are talking about people who have kidney disease, people who have had transplant, or people who are taking medications that are depressing their immunity because of one reason or the other. The other group of people that are at risk of severe COVID-19 or even infection by the virus are people who have severe obesity. And we are talking about people who have a BMI is body mass index of more than 40. And the nutritionist will be telling us more about maybe obesity and relationship with COVID-19 and how we can mitigate against that. So as we all know that I've talked about the population at risk, and we all know that anyone can be infected with the coronavirus, but from various studies, remember since coronavirus started, it's now a year plus, there are many people that have who have gotten down into business to do a lot of research, find out who is at risk. It has been shown that the disease is less prevalent in children. It has also been shown that even the population of children that are affected or infected really don't develop severe disease. And a very small percentage actually develop life-threatening disease that will lead to death. So that is a source of hope for us, even as we send our children back to school. That they might get infection, but many of them will not even develop symptoms. They may not develop any serious disease. And the other thing is that even for countries that have reopened their schools for physical learning in the Western world, the outbreak, there have not been many outbreaks reported in the schools. So we are saying that even when our children go back to school, they are not going to be a source of infection for the community in which the schools are situated, or they are not going to be a source of infection even to their teachers. So outbreaks are not common in schools. So the key prevention of measures are being a respiratory disease. We know that hygiene is very important, like for any other form of disease that is caused by infection. And we are talking about hand washing. We are talking about respiratory etiquette. That means someone sneezes. If you have respiratory symptoms, you sneeze or cough into your elbow or into a tissue paper, and you ensure that that tissue paper is well disposed of. Then social distancing, we are talking about keeping away from your neighbor. You keep at a distance of at least 6 feet. Then proper wearing of masks. So we are not only talking about wearing of masks, we are saying that you must cover your mouth. That mask must cover your mouth. It must cover your nose. It must be fitted well to be able to protect yourself from coronavirus. Then we're also talking about isolation. If someone falls sick, then you have symptoms. If you think you have symptoms of any respiratory illness or even coronavirus itself, then it is your responsibility to isolate. So if your child is sick during this season, then it is the responsibility of the parent to keep this child at home, the child with these symptoms, so that they are not they don't pose a risk to their schoolmates or even their teachers. Then when someone falls sick, of course, it is advisable that we seek medical care early so that we are able to recover well. What is the impact of COVID-19 pandemic? So we know that COVID-19 is a health condition, but given the guidelines and the protocols that have been put in place worldwide to be able to mitigate the spread of the virus, we know that there are many effects that the pandemic has had on families and on communities and even on individuals. So the infection itself, just as we have said, of course, it will make the health of an individual deteriorate and it can cause death. We have economic effects of the virus. So as governments were locking down and restricting movements, we know that many jobs were lost, people lost their livelihoods. So there is risk. Families are not able to afford the kind of lives that they were able to afford before. There are some people who cannot even afford their basic needs. And so there's risk of poverty in the long run. And then we have the learning crisis. Remember when the first case was reported in our country, the first thing that the government did was to close down the schools. And most schools have been closed all this time until probably next week is when most schools will be reopening. And because of that, we have a lot of lost time in terms of learning time. Children have stayed, during this stay at home, children have been exposed to all sorts of things that are detrimental to their health and their survival. We have been told that there's been an increase in child abuse. There's been an increase probably in child labor. There's increase in child marriages, and we are having adolescent mothers. So all this in the long run, the final analysis, what is going to happen, not just to Kenya, but to globally, is that we are going to have long-term effect in delayed implementation of our 17 SDGs. And the main ones we are talking about is the goals that talk about eradication of poverty, the ones that talk about quality jobs, the ones that talk about quality education, eradication of hunger. So we realize that we are going we are going back to where we were instead of moving forward. And in the long run, we are not going to achieve these goals at the stipulated time. So there's general risk to child safety because of the factors that I've already mentioned. Then it is important to note that some of these things are things that I've said there above, that our children need to be in school. Why do they need to be in school? It's because of the effects that prolonged stay at home has had on the children, on their families, and the community and the nation at large. We know that the fact that the children have stayed at home, and I'll be talking about that later, there have been very many risks that these children have been exposed to, and I'll be expounding on that later. And then we are saying there is no way, whether the children are at home or in school, there is really no way of ensuring that there's zero risk to infection, that is COVID-19 infection. But the good news is that if we practice discipline, we are able to adopt ways to minimize the risk of spreading the infection. And the fact that COVID-19 still has no cure. COVID-19, there are vaccines that have been tried. There are few that have been now confirmed to be effective, and some countries already uptaking the vaccines. We know that COVID-19, just like any other respiratory illness, might be with us for a long time. So are we going to close the schools for years when the COVID-19 is going to be with us? Then the school outbreaks, just as I had said, has not been a prominent feature in the COVID-19 pandemic, even for those communities that have reopened their schools for physical learning. And majority of students, again, as I had said, is that they do not get serious. Yes?
Could you read the previous slide?
Yes.
We were taking notes. Oh, thank you.
Oh, you're taking notes.
Yeah.
There is a recording. There's a recording of the presentation. Probably we'll also share that.
Oh, okay.
Can I move on?
Yes.
Okay, thank you. So this slide, basically, the slide on important note is basically the things that I'm talking about. I've already talked about. So what are the benefits of returning to school? So we have said many governments across the world have been slowly reopening their schools, and many have reopened and have put into place task forces that have tried to analyze the risk of children being in school versus being at home. And we realize that even though we have developed guidelines, we are still struggling to adhere to these guidelines. But still, education, just like many other rights, we have right to life, right to many other things. education is also a legal right of our children. So that's one of the reasons why the children need to go back to school. And the other reason is that when we allow students to go back to school, they'll be able to complete their studies and continue to the next level. When our Ministry of Education announced that 2020 education calendar has been lost, there are many students, especially the examination classes, many students were distressed because they already knew they were going to complete school. What would happen to them if they lost the whole year? And then now they would be with their juniors in the next class. For us, apart from the fact it's a legal right, so these students, with the fact that they were able to go back to school and complete their studies, sit for their exams and move to the next level, basically is something that is important to our children. Then there's a group of students, especially what we call the group that we call OVC, the orphan, the vulnerable children. There are many that don't just go to school because of education, but school also is a source of nutrition for them. It's a source of various essential services for this group of children. It is to protect them. Look at those the kind of children who live in communities where they carry out FGM. So being in school is a source of security for these children, for their welfare, and also the ones who experience abuse in their households, in their environments at home. So it protects them from violence. So these children will need to go back to school. And just as I mentioned in number one, being in school for the children, it somehow provides a source of some routine, organization, and order in their lives. And it's also a source for them to interact with their peers, which is very important for our children in high school during their teen years. So interacting with peers is an integral part for their development and well-being. So social and psychological well-being is important aspect of having the children return to school. Then access to reliable information on how to keep themselves and others safe. So you remember when the children are in the community, the parents have different beliefs. I don't know whether you've also experienced such kind of people in the city or even in the villages. There are people up to now who still believe there is no coronavirus. So these are children who have been given and have been exposed to unreliable information, misinformation. They've been told that coronavirus is a propaganda and the government is using it for certain ends. So when we keep these children in school, basically it will be a source of uniform information, reliable information to help us keep them safe. It will reduce the risk of non-return to school, and I already mentioned that earlier, early marriages and teen pregnancies. It's a benefit to the society in the long run. You remember we had talked about the SDGs. So there are parents who cannot go to work because their children are at home. You remember, even if you can afford the online learning, most children need parental guidance when they log into those gadgets to be able to interact with their teachers and tutors online. So some parents have to stagger their work hours. Some basically had to drop out of work because of needing support to give support to their children. So you'll allow the parents to go back to work, and in the long run, of course, support the children even in school. So what are the main considerations as the children go to school? So I combined what the UNICEF is saying, WHO is saying, and what our government guidelines is also talking about. So we are talking about social distancing, and we said social distancing means keeping a distance of at least 6 feet. And we are talking about, that's about 1.5 meters. So in school, we are talking about classrooms. So remember, in classrooms, we have desks. So this desk, that means in a classroom that initially was holding about 45, 50, and in some public schools, there are schools that are had been holding up to 70 students. So it means now the classes are going to have like 20 to 25 students because they have to space out their desks. Then in the classroom, we are also talking about the distance between the teacher and the students. We're also talking about the laboratory. What is going to happen in the laboratory? Remember, we are carrying out experiments. They're supposed to be in groups and they're supposed to be together. So the guideline is talking about what is going to happen in the laboratory. We have boarding facilities. What about the decker beds? What is the distance between the bed, the lower bed, and the bed on top? Is it 1.5 meters? They're talking about elaborating what is going to happen to toilet facilities. Should children have a queue in front of toilets as it has been happening? So it has even restricted the number of students that can use one urinal or can use any pit latrine in the schools for girls and for boys. Then it outlines also transport. When your child is going back to school, do you have a reliable form of means of transport? Is it a safe means of transport? Are they observing social distance? Does the means of transport have windows that can be opened to allow even for ventilation? Extracurricular activities. So it means during this time, probably we are not going to have those extracurricular activities that involve a lot of crowding, the ones that involve touch and contact, things like rugby, we are not going to have them. And then the guidelines also talk about cleaning and hygiene. So it talks about surfaces, so how the surfaces will be cleaned in the schools and frequency. The hand hygiene, of course, cleaning hands with soap and water and sanitizing. We are talking about ventilation in the classrooms. So in the classrooms, of course, the windows need to remain open. There should be fresh air circulating in the room. We are talking about cough hygiene and cough etiquette in the classrooms and in any other place in the school. We are talking about face covering, so we are talking about the face mask. Of course, the government has already outlined, and the schools are coming out with specific guidelines on what kind of mask and how many masks each student needs to return to school. And so it is upon us as parents basically to provide those supplies. Then they are also talking about monitoring health of students and staff. So how is screening for these symptoms? So we talk about cough, we've talked about fever, we've talked about difficulty in breathing. So there is carrying out of screening at the entrances of schools. We are carrying out screening in the dormitories. We are carrying out screening even amongst the students themselves. You know who amongst your classmates are sick. So you can actually report that to the school nurse or even the matron. And the schools are also connected to various health facilities within the vicinity. What about handling of students and staff that have been found to be sick? So the ones that are sick, for most schools, they have isolation centers. Remember, even before COVID-19, most schools have sick bays, places where sick students would receive care and be isolated and find rest. Schools have a nurse, and even the ones that don't have permanent nurses, they work together in collaboration with the nearest health facilities. How will the students and even the staff cope with their mental health needs? So there will be training, basically, again, together with the nearest health facilities. And of course, the counties also have their COVID-19 response teams. There will be continuous provision of mental and psychological support for the staff and the students that need them. Of course, in this case, we need to, the students and even the staff have to be free to report what needs or the fears they might have during this season. And then, just as I mentioned, that the schools have linkages to the nearest healthcare facilities, that is within the counties. And monitoring of high-risk populations. So high-risk populations are the ones that I mentioned about as the ones that are at a higher risk of contracting COVID-19. So we are talking about students who are going back to school, and we know they have chronic medical conditions. We are talking about students with asthma. We are talking about students who might be having kidney disease, who might be having liver disease or any other respiratory disease, or on treatment for any medical condition. So in this case, when we are sending students to school and they have high-risk conditions, it means we'll need to collaborate with the administration, the school specifically, so that they know the needs that our students have, our children have, and they know what support these children will need, especially when they fall sick while in school. But even for the parent, you ensure that we send the children in school when these chronic conditions are put under control. So we are talking about education. Of course, this will be a continuous thing, just the way it happens in the normal school routine during assemblies, but this time there will be no school assemblies. What the guidelines are talking about is having class assemblies. So classes will be having their own meetings. COVID-19 protocols or any announcements that need to be made will be done within the classrooms. Of course, the staff members have their staff room and offices where they will get this kind of communication. How do schools link with the parents when the students are in school? So the schools have to come up with a platform where they can link with the parents to update them regularly on what is happening in the schools. Of course, if there's an outbreak in the school, the parent should know. If the child is sick, the parent should know. And the school should let the parent know what kind of assistance it needs to be able to take care of that particular student. There's that group of students that might need yearly vaccinations, especially the flu vaccine. So you remember, this is a respiratory illness, and we have said those who have chronic conditions are more at risk compared to the general population. And most of these people usually need a yearly flu vaccine. So if you have such a child, then you ensure that apart from flu vaccine, we give them we update all their eligible immunizations so that when they go to school, we know that they are in good shape and they are well protected and their immunity is taken care of. What about collaboration and coordination? Of course, that is now upon the school to be able to collaborate with the local health authorities, as we had mentioned. So we'll talk about what the parents need to do, and it's a lot of repetition. It's basically the things that I've been talking about. So if you have a child, before you send your child back to school, especially the child with chronic conditions, first ensure that the child's health condition is put under control. And that you can only do in collaboration with your primary physician or pediatrician. Then this child should have enough of that, what they require to be able to control their medical condition. In terms of nutrition, which the nutritionist will talk about, that when the children are at home, we ensure that they are eating well so that their nutritional status is up to date. I've already talked about updating the immunization. The parents at home need to continue teaching and modeling. And we are not just telling them what to do, but we should be seen by our children to be doing and following the protocols that the Ministry of Health has laid down. So in so doing, when we do that, when the children go to school, it will be very easy for them to be able to adhere to the protocols and the guidelines that have been set out. Then adequate supplies, of course, they will need masks, they will need soap, sanitizers, and medical supplies. We should encourage, you remember we had talked about psychological health and mental health. As parents, we should encourage our children to be outspoken, to be able to express their feelings. They might go to school, just like many parents are going through stress right now. Even children are going through stress, anxiety, some are afraid of things they may not be able to verbalize. We should encourage them to identify either a teacher or even an older person in the school that they can confide in, so that they share the feelings that they have, so that they can get psychological support. What about stigma? So for stigma, of course, we know, I was sharing with my colleagues earlier, that even in the medical fraternity, there are doctors or nurses who have been labeled that they are too strict with the guidelines. Maybe they are thought to fear the government, or they are thought to be sycophants of sorts. But we want to teach our children that we should not stigmatize, especially those kind of students who might be coming from homes that have been affected by COVID-19, either probably a relative or a parent has died from COVID-19. We should teach these children not to stigmatize, not to label, not to call them names, but instead be a source of encouragement and a source of, we model discipline, and also be our brother's keeper basically in school. And then we have talked about coordination with the school. So the parents should be in contact, communication with the school to know how the students are doing. And above all, we should continue to reassure our children. Just as I said at the beginning, is that they are safe in school, they're actually safer in school, and they need to be in school, and they will be fine. What about the students? So we already mentioned that the students should be open-minded. They should be free to share when they feel sad, when they are worried, when they are confused and scared. Probably a student has been identified or confirmed to have an infection. What happens to the friend who has been maybe interacting with that particular student? If they are afraid and they are fearful, they might be affected. Let them share so that they get the support that they need. then every student should have the discipline of protecting themselves, because only in protecting yourself will you be offer protection to others. So of course, the simple hand hygiene that we have talked about, not touching the face, the nose, the eyes, or the mouth. And the guidelines above also talked about how the dining area and the kitchen will be handled. We are telling students not to be sharing personal items like cups, utensils, foods, and drinks. Of course, we continue to social distance in class, of course, in the field, in the dining hall, in the boarding areas, in the toilets, and everywhere else in the school. And they should continue to properly wear their mask and also dispose of the mask properly. So we can wear the masks well, but then we throw them everywhere in school. There's still also a risk. They pose a risk to spread infection. The student should be a leader. So the student has heard about COVID-19. They've been taught by their parents. They have seen what the government has been stressing. So the student should act as a leader to share this information with other students who might not have had this information. And they share, but they will also model good practice and discipline in observing these kind of practices. We have talked about not stigmatizing their peers or not teasing them because of either their COVID-19 status or where they come from, or the fact that they've been affected. Let them be a source of support for such group of children. If they have a problem, if they are sick, they should tell the parent. Of course, if your child is sick to a level where they are severely sick, of course, together with your physician, probably that child might need to stay at home. So in summary, we are saying that COVID-19 is a respiratory syndrome. It affects all ages, but we know that it is least severe and least prevalent among the children. There is no way of ensuring that there's zero risk to infection, whether the child is at home or in school. But the good thing is that with discipline and cooperation among all of us, we are able to mitigate the risk of spread of COVID-19. The benefits of reopening school far outweigh the risks of infection and outbreaks. In general, this severe disease is not common, even amongst children who have underlying conditions. So even parents who have children with underlying conditions, we should not be afraid to send them to school. Then lastly, our children need our full support to keep them in school. That is in terms of their health, keeping their health updated, psychologically, giving them enough supplies, and modeling good practices as parents at home. And my references are there. If you need more information, you can go to those sites and you'll get more information about COVID-19 and reopening of schools. Thank you.
Thank you very much, Dr. Mondi, for that. Thank you, Dr. Mondi. Thank you for that captivating presentation. And thank you for reassuring us that it is more important to send the children to school than to keep them at home. And we are also glad that at least you have not had severe outcomes in healthy children, but we must take care of ourselves. That's especially the children, take care of yourselves because of the teachers who are in your compound and other people who are a bit aged and they might be severely affected by the disease. Thank you so much. Next, we're going to have a nutrition expert by the name Dr. Catherine Motier. So Dr. Catherine Motier is a nutrition expert with Tananga, which is an organization based in Nairobi. And she has over 15 years of experience working with the government and the NGOs. And Dr. Catherine has worked previously with the Global Alliance for Improved Nutrition and also the Ministry of Education, Science and Technology. And she taught in several universities. Dr. Catherine is a PhD holder and has a wealth of experience, especially in nutrition. She's married to Dr. Gideon Kikuvi. She has 2 girls, 15 and 11 years. So she has actually experienced what the high schoolers, the parents to high schoolers are probably experiencing, the anxiety and all that. And I take this time to welcome Dr. Motier. Dr. Motier, take over tell us whether we need all these supplements that we are buying left and right, or whether we are okay to go back to school. Karibu.
Okay. No, thank you very much. Can you hear me?
Yes, we can hear you.
All right.
Yes, we can.
Yeah.
Okay, good. Thank you. Thank you so much. I'm excited this evening just to share some thoughts. And like we've said, I'll actually just be sharing some thoughts on healthy eating for high school students. So I know in this forum we have parents, we have the students who are in high school. So just in case you feel like I'm concentrating more on the high school students, is because I chose that to be my target audience tonight. But even the parents in here, I'm sure that you will also learn a thing or two. So this evening, again, we just thinking about nutrition and COVID-19, and I'm glad that Dr. Modi has just, Dr. Juma has just also shared with us, the basics in terms of health guidelines from the ministry, but also what is really on the ground. We know that as human beings, then we have to think about food, and wherever we are going, be it at school, be it for holidays, like we are in a holiday season at this point in time, it's really about food. And so it's a good time to think about, about nutrition, even as we think about going back to school. So basically then I'm going to have a very short outline, a short presentation on exactly who is this that we are talking about in high school. And this is important because when it comes to nutrition and thinking about what is it you need to think about food, about healthy eating, then you must be knowing who you're dealing with and who is your target. And what is it that we eat less or we eat most, considering that we will define who is that person who is in high school. And then briefly, we look at nutrition and immunity. And this more so is because of COVID-19, because that's why we are here tonight, talking about food. So what's the role of nutrition and immunity? And I know it's of interest because I know we have had a lot of conversations, and maybe some of you have received a lot of WhatsApps talking about supplements that you will need to take or not take, or even maybe other herbal things that you might want to eat or not eat. So we'll just briefly talk about micronutrient supplementation. And then, of course, which are the behaviors we need to adapt if we do not already have them, or we need to maintain. This is especially so for those of us who will be going back to school next week. And I'm aware that some of us might be in boarding schools, some of us might still be with our parents because we are in day school. So the circumstances may be different, but in terms of expectations for what you may need to eat may not change. And finally, again, knowing who our target is and knowing that there's always a bit of anxiety, we will speak briefly around about eating disorders. And basically for eating disorders, I know we have a psychologist at the end, so to speak to us, so I won't concentrate so much, but I will talk about it from a nutrition perspective. So thinking about who is this person who is in high school? In Kenya today, I think many of us who are in high school are between 14 and 19 years old. Of course, we have outliers. We may have a 20-year-old or so. But in essence, what we are saying is that we have a group of young men and young women who are at a stage that is very crucial in life, because it's a time that you're developing lifelong eating habits. Among the many other habits you will develop, some of the habits you develop now include what you eat. And so it's important that we keep remembering what we need to eat and what are then those habits that we need to keep. And we are also thinking about this young woman or young man who is vulnerable to peer pressure. and media, for example. Maybe many of us already have been having gadgets in the last couple of months. We've been on Zoom, we've been on WhatsApp, we had free maybe access to phones because we needed them to be able to attend online classes, and maybe just a television in the house. So, and the things we see, the things we share amongst ourselves influence the decisions we take. And so thinking about peer influence and nutrition is also about body image, and how food is marketed. So the adverts we see on tele, or that thing that is shared with us that makes us make some choices on what we eat, why we will eat a pizza or why we will eat a burger and maybe not eat a fruit. It has got to do with marketing. But also a very interesting thing about this person who is in high school. You are actually a parent of the future. I know today we are here with our parents, but imagine you're also a parent of the future. And your nutrition status, your status in terms of nutrition will shape the next generation. So we keep saying the youth are the leaders for tomorrow, but even parents, you are the parents of tomorrow, so to speak. And so the healthy habits or the eating habits you develop now are very important. However, you are also the present. That's very critical. And I think today we are talking about your present. So we are not talking to you as a parent if you're in high school, but we will talk to you in your present. What is it that you need to eat? What is it that you need to develop, as a young man or a woman? But of course, we also know that as a high school person, you may be experiencing different types of malnutrition. And when we talk about malnutrition, we're just talking about things that are not right nutritionally. I may not see all of you, and maybe none of us here is overweight and obese or obese, but it is possible that we have that even in our midst. And especially those of us who are living in the cities, in towns, not doing a lot of work, sitting on television the whole day, eating every time now and then. There is a tendency that young people tend to be overweight and obese, depending on the lifestyles they are leading, but also what they are eating. But unfortunately, and especially in our country today, those of you who are maybe even in public schools, you will realize that we also have an issue of overweight and obesity. Underweight and micronutrient deficiencies. Some children are coming from difficult areas, and maybe you're among the advantaged, or, you listening to us here. But in your institutions where you'll be going back to school, you might find those children who do not get enough, or over time they are underweight. But even some of us here, or some of us that we will meet in school, a high schooler, a number of us could be having micronutrient deficiencies. And when we talk about micronutrient deficiencies, we are thinking of, lack of adequate vitamins or adequate minerals. But from a public health, thinking about what really affects a young adult, an adolescent girl, a young woman, a young man, we will be thinking more about iron, because of these girls who have just started their menses. And so there's a lot of requirement for iron in the body, but also for the young men who are really growing up, growing tall, requiring much more, iron in their body to grow and to be able to function well. And of course, is the time, a lot of bone formation. So again, we might experience a bit of calcium deficiency. So it's important that we know who we are and the things that we might actually be dealing with beyond the COVID issue, that there are already things that could be an issue that we need to address. And this is the target that I'm going to speak to in the next few slides. So defining who we are, it's very important, because then it defines what are the issues we could be dealing with. You could be looking very healthy, but you have this dizziness that comes every now and then, and it's maybe just because you are anemic or you do not have enough iron. And no one might know it until maybe you go to the doctor and the doctor gets some tests done. So, and this can be avoided if we have the right diet. So, what is it we eat as high schoolers? And with me here, I picked a few things that we eat last time, the things that don't please us, the things that don't make us very happy. And some of them include fruits and vegetables. You find that for us, the young people, those of us who are in high school, maybe a fruit or a vegetable is not a snack for you. It's just that one other thing that your mom or your dad or your guardian, just keeps enforcing in your house. And you're thinking, I'm better off with ice cream, for example. Of course, other things that we find young people not eating very well is things to do with milk, calcium, milk and milk products. This might include milk, it might include milk products like yogurt, but of course also whole grains. Now, you find that some of these foods, it's not just the young people who are not eating, it's not just you in high school, but it's probably where you're coming from in your home. Maybe your parents also are not taking care of that. So again, for those of us parents who are here, it's also thinking about those things that we need to be able to provide to increase consumption. Now, of course, it's always fun to have a soda out there, to have all these drinks, and I think they're always very colorful shelves. If you go to the supermarket, you'll find all those types of drinks, fizzy drinks, that you may want to take, but those sweetened beverages, we tend to eat more, young people, you tend to eat more, but is that the right thing? Fast foods, foods with high fats, a lot of fats and salt, and you were thinking about fried foods, and also highly processed foods. When we think of highly processed foods, we're thinking about, the meats, the salamis, the sausages that you want 3-4 pieces every now and then. And the question is, what are you doing? What kind of healthy habits are you, or what kind of habits are you developing at this point? And as we think about COVID and the circumstances that we are in, it's important we start looking at what is it that we eat more and what is it we eat less, yet it's the healthier option. What is it we need to do to be able to increase that which is healthier in our diets? Remember, the high schoolers, we are on that stage, we are at that stage of life where we are developing lifelong habits, including our eating habits. So this is a time that you have an opportunity to control what you eat, to define what you consume now and even into the future. And thinking about it, why would we be talking about the whole foods, the calcium, the milk products, fruits and vegetables? It all has to do with good nutrition, because good nutrition is key to build your immunity, including immunity to COVID, to protect you against illness and infection, but also to support recovery. It's possible that some of us might already be, have been exposed or will be exposed. But if we already have good nutrition, it's possible that with good nutrition, then we are able to support recovery. And of course, for that to happen, then we need a lot of balanced diet, for example, which is very key in boosting our immunity, but also to prevent non-communicable diseases. I'm sure maybe some of you, if you have had news or you might have had what is coming out in this season of COVID, is that many people with issues with diabetes or hypertension, high blood pressure, they are tending to have severe COVID-19 infection. Now, what you need to note is that those non-communicable diseases, most of them are actually diet related. So they are related to what we eat and what we do not eat. If you think about diabetes, of course, it's something that comes over time. If you think about hypertension, high salt foods, you're eating a lot of processed foods. So you're having to carry a lot of sodium in your body. And so at this point in time, whatever you put in your mouth is important for you to take care of that, because it might influence whether you will get an uncommunicable disease later in life or even now. And that also, of course, predisposes you to have a higher risk factor for COVID-19 morbidity, the disease, but also the mortality, which is death related to COVID-19. Of course, we are very aware, like I mentioned at the beginning, for those of you who might be going to boarding schools, you may not have so much choice. It's not that you may not actually have a lot of control over the foods you're served. But even at home, as much as you might have some control, your parents, and that's why I'm happy that we have some parents here, they also make decisions on the foods that we serve or the food that is served. However, as a high schooler, the message I have for you is that you have a responsibility to make healthy choices. And this is critical because if you go to school and you're served a meal and you think, well, I don't want that githeri because it has some beans. I don't eat beans. I want to go and eat bread. You go and just get some processed bread in the canteen because you can afford, or you think that's the better food for you. That is not a good healthy choice. It's not the right choice for you at this stage. If there is a fruit served probably in your school, depending on where you're coming, please take it and don't share it don't be the one always sharing with your friends. That fruit is meant for you. And that's why every student in your school will receive their fruit. And of course, if you have to go out, what are the choices you make in terms of the foods you eat? I keep saying that it is also okay to buy a packet of milk and drink. You do not have to buy a cola. You do not have to buy a Fanta. That's while you're in boarding, but also when you're in school. I mean, when you're at home and you have to carry your own snacks. What type of snacks are you going to be carrying to school? So those are the choices. And you have a responsibility as a high schooler. Remember your age. Remember you're making healthy choices. You are able to influence even your parents on what they can buy for you. It may not taste nice. It may not be what maybe your peers are carrying, but it is healthy for you. And that's what we are encouraging, that even in this season, as you go back to school, please take and make healthy choices that boost your immunity, boost your nutrition situation. And thinking about that, of course, like I mentioned, there has been a lot of there's always a very heated conversation around supplements. We are always saying the food we are eating, maybe it does not have enough micronutrients, and we need to have some more supplements. What you need to note is that they are just supplements. Just like the name, they are supplements. They are only supposed to supplement something. And that means you need to be doing the right thing, or you need to be doing something which you have a control over. The decision you take around what you eat, when you eat it, and when very necessary, you will get a supplement. However, as much as we know that micronutrients are critical, for a well-functioning immune system, of course, we know that COVID-19 is very recent, so a lot of studies are still coming up. What we know is that right now, the World Health Organization has still not given us any guidance on micronutrient supplementation. So the vitamin C, the zincs that we have had people taking, it's really not about COVID-19. It's just because zinc, you might think about boosting immunity. Vitamin C, I think we have always heard about vitamin C and flu and homa, so to speak. But what is most important, and even for us parents who are here especially, what is most important, where possible, your micronutrient intake should come from a nutritionally balanced and diverse diet. When we talk of diverse diet, we are talking about those vegetables. Don't just go for cabbage and skuma from Monday to Friday if you can afford. Go for the dark green leafy vegetables. Get some fruits that are on season in your table, for people to bite on and to have them as healthy snacks. If it's whole meal, whole grains, we may not always have bread that is whole wheat bread, but you can make those decisions around your ugali. You can make decisions around what type of other grains you can have in your household that can improve your intake of whole meal grains. But of course, things like nuts, So we are saying that within a day, eat as diverse as you can. And what we know is that, thinking about population studies, the more diverse your meal is, the less likely you are to have a micronutrient deficiency. So that you realize if you're eating a well-balanced, a well-diverse diet, you will not actually need to add on into micronutrients. However, we know there are instances that there will be requirements for micronutrients supplements, for example, for pregnant women. But here we are talking about high schoolers, those of us who are in school. If need be, the government, in Kenya, we talk about iron, as a supplement that can be provided at a public health level. But of course, we're saying in school and at the age that we are in, chances are that if you're eating well, we're actually not required to have those supplements with us. And of course, unless, of course, you have, again, for those who are lactose intolerant, they may not eat, milk and milk products. The alternatives of calcium sources, they may not be the very strong, but you find that there are other foods that could also provide you with calcium. And of course, some of them even including some vegetables. So again, the way our food is that it is possible to get all this food. Supplements, what we need to know is that they have been marketed again as a business. So we need to be careful not to overthink about how our food is not adequate, but actually have a diverse from what we have. Having said that, then, what are those behaviors that we need to have? And especially those of us who are going to school, going back to school. Two things. One is the healthy eating, but number two is physical exercise. Remember we said that one of the problems we could be having is obesity and overweight. Then we need to start balancing that with issues to do with physical exercises. But even those of us who are not obese, those of us who are not overweight, it's important that we have physical exercise as part of our healthy habits that we have around food. And of course, when you're talking about food, we'll be talking about eating a balanced meal, where possible include an animal source food such as chicken, an egg, fish or meat. And this could be home. So guys, before you go back to school, if where your parents have provided, please eat some of these things. They are important for you. You need them for your body. But also increase fiber in the diet while decreasing the use of salts and fats. So I know chips is good, and I know many of us are looking forward for opening day to go and eat our chips once in a while, yes, but let it not be your daily diet, And of course, even in our homes, we avoid foods that are really overfried, a lot of fats and oil. So basically, we're looking at what is it we need to reduce so that we avoid things to do with overweight and obesity, but also those things that can make us have non-communicable diseases. And of course, important to drink water and avoiding drinks that are high in sugar. Instead of that soda, instead of that Fanta, please go for a drink, plain water, good enough. If you must, you can take carbonated water, just to feel nice. But avoid sugary beverages. And of course, when it comes to healthy snacks, we're talking about, it's really not about sausages. It's not just about burgers. Can you have a fruit in your bag, when you step out? Can you have an apple? Can you have a fruit in season? And of course, I know in school, those of you who are in boarding school, like we've said, you could have limitations. But whatever is provided, as long as it falls within this category, and the ministry supports schools in getting these maybe resources available, it's important that you make that choice. So you who is here tonight, you have a personal responsibility to make healthy eating part of your behavior. but by being very, very aware of the things that you need to avoid, but also the things that you need to eat more. So speaking about that and really coming to kind of a close in terms of eating disorders, again, remember we are the high schoolers. We are at a stage where peer pressure is an issue. And sometimes maybe because of the lifestyles we have had before, probably we find ourselves that we are overweight, we are obese. There's always a place for, becoming better. But we know that in some instances, it becomes a disorder that needs to be managed by more people, not just you. You need support, you need help, like Dr. Juma just mentioned before, that, call out for help, and we have various disorders. So some of us, maybe we are just about to go back to school. You didn't want to eat because you're going back to school. But of course, it's not just because you're going back to school. This could be an obsession that you start eating and you kind of have an obsession with food. You don't care about your weight, body shape, or sometimes you could also be that you fear eating until you become underweight. Remember, we had an issue of the problems that we might have as adolescents. We have some young people who you really do not want to gain weight, and so you avoid eating. Or if you eat and purge it. So those things are not healthy. And if you have them, and you as a parent who might be here, if you note some of those things, it's important that you speak to your pediatrician for your child, but also you can have a psychologist for help. And I'm glad that in this team, we have a pediatrician and a psychologist with us, because when it becomes a psychological condition, then you do not just want to manage it with food, but you want to be, you want your child to be supported emotionally. But of course, even for us high schoolers who are here, before you get there, it's okay to grow. It's also okay to eat. Please don't overeat. Please don't undereat. And if you have an issue that is disturbing you, even as you're going back to school, it's always important to speak to someone who can be of help. So these eating disorders, of course, they will or you might even have micronutrient deficiencies, or you could end up being overweight or underweight, obese. So with that, then, I would say that really, as a final thought, balanced diet, a healthy balanced diet for every individual is key. So it's not just about you, the high schooler. If you have a younger sister, a younger brother, an older brother or an older sister, or even your parents, you have an opportunity to influence what you eat, because balanced diet is key for boosting immunity and preventing non-communicable diseases that we have just said they are risk factors for high COVID-19 morbidity and mortality. So with that, I will stop there, because when it comes to food, we all have different experiences. But for those of us going back to school, please make healthy choices where you can. If you have to choose a fruit, please eat it. If you have to choose what to eat, don't just go for processed foods, but go for those whole meal foods. Thank you very much.
Thank you very much, Dr. Catherine, for that reassuring talk. So parents, let our children eat healthy, especially this week, so that when they're going back to school, they'll be very strong. And for the students, the time now to make the healthy choices, eat what is healthy and avoid getting the junk from the canteen. Maybe the teachers can help us in this, at least monitoring that every child is eating, they are taking their meals, they are finishing, and they are not avoiding those meals. We know now that COVID-19 is a community infection, and it may come to any one of us at any one time. So the weapon we actually have is good nutrition, keeping ourselves ready so that when this bug comes, we'll just be able to fight it. Yes, and to add to that, vitamin D, let's remember to be in the sun, at least, I think, for 30 minutes. Let's not avoid it. As students, probably you want to catch up, the exams coming, but you still need that sunshine. It's very important. Thank you so much. Next, we're going to have the psychologist, but before that, I have a guest by the name M.O. I don't know whether she wants to tell us her name. She has had exposure to COVID-19, at least come into contact with people who are infected, but she was not affected. She's going to give us her experience, and especially a psychological experience when you have to go through such a thing. Welcome, M.O.
Thank you so much, Dr. Kihara. Michelle, I'm a student, university student at the University of Nairobi. I'm actually Dr. Kihara's student, so I thank her for this opportunity that she has given me. I'm here to just share my experience ever since the COVID-19, the first case was announced in Kenya. So basically, all of us were, when the announcement was made that all of us need to go home, we were all worried, and no one wanted to associate with anyone who maybe had contracted the disease and such. So sometime back in July, a very close relative of mine, they confirmed positive for COVID-19, and in one way or another, personally, I was in denial because I didn't expect that. And it happened that maybe we were living in the same house, and then that morning they tell you that, you know what, we at our workplace, all of us were requested to do a test, and I tested positive. So I was in denial. I was very anxious because I didn't know how to go about it. And it was really a tough time personally for me and even my other family members. And by that time, I think most of us didn't know how to go about it. We didn't know who maybe to approach, who to talk to, how to handle the situation. And also we didn't want to make our one of our family members who had tested positive to feel bad about the whole situation. So we all went for the tests. Fortunately, all of us, the other family members tested negative. So we had to really come through for our family member who was positive for with the COVID-19. So we were there to support her, both emotionally, physically, and not making her feel bad. It's just a disease, it's a flu, as most of us will say it, it's just a flu, and it will just come to an end at the end of the day. So luckily she got well, she recovered from the disease. Then back in early November, we were asked to go back to school. So when we went back to school, unfortunately, a classmate of mine also tested positive for the COVID-19. And ideally, in our school, they are coming with a mode of teaching students. We don't do the way maybe you go to a hall and get your lessons from there. So they're actually narrowing down everything, since we need to keep distance, since we need not to be in crowded places. So we are trying to do more of group lectures. So one of my classmates who had tested positive happened to be one of my group members. So she had explained to me that over the weekend that she was not feeling well, she had flu-like symptoms, she had fever. And so I requested her to maybe go for a test so that maybe we'll be sure, since I was very cautious because I was like, you know what, I'd previously been exposed to someone who had COVID-19, and I didn't want maybe anything bad to happen to some of my classmates, maybe in one or another, who had not been exposed to the virus. So after she went for the test, she tested positive, and we were asked, all of us from that group, we were a group of 6 students, we were asked, all of us, to go for self-isolation for the next 14 days. At that time, I felt really bad because in one way or another, the school had not come up with a way whereby these students maybe in one way or another had tested positive. How are they going to be handled? Because any of my group members will you'll be walking down the hall in the school compound and you'll hear someone saying, excuse me, ni group gani yo, which one of them has tested positive and such. So it was really a bad situation for most of us. Because now you feel really bad. Some of us, like some staff, even teaching staff, even the supporting staff, they were looking at you as a plague. And I felt like it was not really the thing. Because in one way or another, they really had to come up with a way of, supporting these students who have maybe tested positive. Or if you have not tested positive, you had come into contact with the one who has tested positive, not make you feel so bad about the whole COVID-19 thing. So when we were in self-isolation, it was really a tough time, because now most of us didn't know how to handle themselves with the anxiety that the disease comes with. And some of my group members also, it was their first time to get exposed. So they were really worried. They didn't know how to go about it. In one way or another, they didn't know who to talk to when they felt like, when are we maybe going back to school? When will this thing come to an end? Do I have it or do I not have it, and such? So even as the high schoolers are going back to school, I want to just urge the parents, even the parents especially, there are those parents who also don't know how to handle maybe a student who have come to contact with a positive patient. Because you'll find maybe a parent, when in one way or another have been told that maybe, I'm out of school because one of my classmates had tested positive, they're the ones who are going even to make you feel bad, more than the way you are feeling currently. So I feel like parents need to be there to support their children, and don't make them feel bad. Be their support, give them moral support. And the anxiety that it comes with, I believe the psychologist on board is going to explain more on how to handle the anxiety that it comes with, how to manage the stigma, and the teachers also, when in case any of the students or any of the other staff members contract the disease, they need to know how to approach the situation. Because it really feels so bad when one of you is positive and no one is even checking on them. No one is even saying hi to them. They feel really bad. They feel like, we have been abandoned, and we are not meant to be where other people are supposed to be, and such. And they feel more like they are outcasted from the normal society and the normal community. So I feel parents, teachers, and even the supporting staff at school, they need not to make this issue a big thing. They need to be there for the students. They need to be there for any other person within the school compound, maybe who has contacted the disease, to feel more accepted in that environment. Because you can imagine you've contracted the virus or the disease, and people are treating you so badly, like you are neglected, no one is checking on you. When people just hear of your name, they're like, that one, no, I cannot even go say hi to them, or I cannot even just know how they are doing, how their health is currently. It's really a bad feeling. And much has been said by the previous speakers on the modes of maybe communicating, modes of maybe getting support, modes of maybe getting more about the COVID-19 and how to manage anxiety, how to manage stigma, both at home and at school. Because this thing, it's not all about that. Maybe when the high schoolers are going to school, they are going to get it from the school. Some of us, maybe we might just be coming with them from home and we take them to school. So it all depends with how maybe it was handled back at home. In case any of your relatives had it when you are at home, at least you'll get to help maybe a student who might get it at school. And you try and encourage them. Don't make them feel bad. Just encourage them. that it's a flu, it will come to an end, in as much as it goes bad to some other people, but at the end of the day, we need to be there for each other. So I believe that is my experience. And yes, my classmates, some of them were good. Some of them were that category of, you know what, you people, you have the virus, we don't want you anywhere near us. But most of them were good. They really gave us support. And the 14 days of self-isolation came to an end and we went back to school. And one of the students who had contacted the COVID was like, she recovered and she's currently doing fine and she's okay. So I just want to motivate the high schoolers. It's not a plague. The COVID-19 is not a plague. It's just treat it like any other disease that might anyone can get. So don't treat it like it's a plague. In as much as, yes, you need to adhere to all those protocols and guidelines that has been placed there by the Ministry of Health and even the Ministry of Education. Ensure you keep distance, ensure you wash your hands. If you cannot wash your hands, ensure you sanitize every time and again. Ensure you keep, ensure you avoid crowded places and such, just to protect each other. Because in as much as I can be protecting myself, I also need to protect my neighbor. I need also to protect that supporting staff at school who is maybe 65 years and above. And remember, they are at a risk, they are at more risk than maybe me, who is maybe 20 years. So you need to protect that person so that they don't get it. Because in one way or another, if they get it, they might succumb to it. And we don't want that to happen to them. So you need to ensure you protect each and every person around you. Protect your teachers, because some of our teachers are even have maybe the comorbidities and we are not aware of. Some of the students, our classmates have the chronic illness and we don't know. So you need to protect each other. And I still insist on this. Be a support system to your fellow students. Never make them feel neglected. In case they get it, in case even you hear a relative of theirs have the disease, never make them feel neglected about it. Don't make them feel worse than whatever they are facing currently. And yeah, that's my experience. Thank you so much.
Thank you so much, Michelle, for opening up and telling us your experience. Indeed, I'm sure as different stakeholders, we have something to take home. And without much ado, I will now invite Kezia, who is a child therapist, and she'll tell us what to do with all the stigma, the anxiety we are having. You wonder, how will school be come Monday the 4th? So I welcome Kezia. She's a child therapist and a life skills trainer, a founder of Blossom in Heart, which is an organization that deals with training and therapy of teens to achieve emotional wellness and mental health. And she works as a consultant with various child-focused organizations. And recently, she was part of the Britam talk to the parents about COVID and how to handle this thing of the children being at home. She's been of great help to most of us this year. Welcome, Miss Kezia Mutua.
Thank you, Dr. Kihara. Thank you for organizing this meeting and also for ensuring that it has a holistic approach. I like that we have covered everything from nutrition to the measures that we need to take physically to keep ourselves safe. And also thank you to Michelle for sharing your story. Indeed, the anxieties are many. So I'd like to begin by asking us, what are some of the anxieties that we have in regard to going back to school as teenagers, or even as parents releasing your teenagers to go back to school? Just type in the chat box. I'll be able to sample some as we continue. But I'd like to allude to something Michelle talked about. She talked about stigma. And this stigma that comes with COVID, I didn't think it was real until a family member of mine got COVID. And at first, people were calling and visiting when the patient was sick. But the moment they learned that it was corona, even family members began to say, don't visit, don't come. So it is a reality that we may be discriminated negatively if we do contract COVID. But as Michelle said, it's important to treat it as an illness like any other. And so today, that's what we are going to cover, different things to think about, even as we go back to school, and healthy ways to adapt to this transition that COVID has brought. So allow me to share my screen. In a minute. So I hope you can all hear me loud and clear. Okay, so I don't know if you can see my presentation.
Not yet.
Okay.
It's coming.
Okay, thank you. So I'll continue. And I have titled it Thriving Post-Corona because we really do need to thrive post-Corona. And it's okay if that's not where we are at. At least what we are doing is making sure going forward we shall thrive. So I'll begin with a small introduction on change or transition. And this is a change. Indeed, as everyone has said, Dr. Modi and Dr. Kathy, we are all transitioning to this new era after COVID. And with it comes a lot of different emotions. Some of these emotions are positive. For instance, there are those of us looking forward to it as an adventure. We're feeling courageous, we're excited, we're determined. But on another side, there are those of us who are feeling confused, anxious, disinterested, uncomfortable, insecure, reluctant, or we are grieving or feeling guilty or vulnerable at this time. Now, the way the human brain is wired is that we tend to look for the familiar. And that's why change almost always brings both positive and negative emotions with it. So for us, it's to try and strike that balance between the positive and negative, not denying that the negative emotions are there, but accepting them and moving forward in a way that enables us to cope, and not just cope, but thrive in the different life seasons that we may be in. So someone had asked a question about school and home environments. And it's true that some of the anxieties that come or are related to what we are facing with going back to school is in consideration of the school environment vis-a-vis the home environment. So in the school environment, the teenagers may be a bit anxious because the workload might be much. Given the year of rest, you begin to forget some things, and then you're going back to school and the pace will be so fast compared to how it's been in the past year. So it's easy to feel overwhelmed because of the workload that lies ahead. Then you have to consider the teachers. Maybe you didn't live at a very good footing, or maybe you're looking forward to going back to see your teachers and to having a beautiful relationship with them. Maybe you're at the stage, because as teenagers, we are at the stage where we are developing our autonomy. Sometimes we have issues with authority. So that might also stem up in the school environment. There are other workers to consider. And then there are our peers to consider. There's the relationship with the opposite sex, the relationship with same sex. And then we also have to consider vices and risky behaviors that are in our schools. Maybe there's a case of homosexuality. Maybe there's a case of bullying, and you're looking at that and saying, I'm not looking forward to going back to school. Or maybe you can't wait to go back and experience the activities that are there during the co-curricular events. So you're looking forward to that. And so it's okay to feel both types of emotions. So you might be looking forward to the school environment. Maybe you're also thinking about it in terms of a home environment perspective. Maybe home has been a beautiful time this corona. You've gotten to reconnect with your parents, and you're thinking, I need to stay home more, because if I go back, things will go back to the way they were. I won't see my parents as much. They're also going back to work. So this will go back to how it was before corona. And I want time with my parents and time with my siblings. Or maybe you have not had a very good time at home. And some things during this corona, the vices that you all have, or some of the behaviors that you don't like about each other manifested heavily. And so you're looking to going back to school because you're saying, woo, escape from home. And all these things are playing at the back of your mind as a teen, or even as a parent to a teen, as you think about, okay, my teen is going back. And I've seen news stories of these children or other teens who have been doing crazy things. And I can't imagine letting my child go back to such an environment to interact with other children or other teens who have been a nightmare to their parents. And you're just crossing your fingers and praying, I hope my children don't pick up the bad habits in school. So these are the different environments that we have to consider, and each environment is breeding its own types of anxieties. And so it's really important to think, what are some of the things, and have a candid discussion before your children go back to school. What are some of the things that they may not be looking forward to, or they may be looking forward to as they go to school, both in the school environment and in the home environment. So parents, kazi kwenu. Now, another thing to consider is that as they are going back to school, the loss of the familiar can induce stages of grief. Now, any loss, not necessarily the loss of a loved one, can be the loss of that family unit that you've now had in this time during corona, can induce a sense of grief in your teenager, or even in you as a parent. Maybe you will go through the stages. The stages are not necessarily one step follows the other. They are more like jumbled up. You can move from denial to anger, or denial to depression. So there's denial, there's anger, then there's bargaining, depression, and acceptance. So in the denial phase, there's a lot of avoidance. You're making up excuses not to take your children back to school, or the teen is making up excuses not to go back to school. They feel confused, or they might be elated about it, or they are shocked and they are fearful. And this is the time to address those fears. At this point where you sense hesitation, what you need to do is inform, give them what you're doing on your part to ensure that they will not be in any harm, or in any form of danger, and communicate those things to them. As teenagers, maybe they are at the anger stage, they might go through anger, they are frustrated, irritated, or anxious, frustrated with the workload, irritated with the new normal, and anxious about everything or anything. And so as a parent, again, what you need to do at that time is to inform and communicate, or as a teacher as well, is to inform them of what measures you're taking and why. Remember, these are in as much as they are children, they are also adults. So you need to explain and give the reason behind things, not just give orders. And then the bargaining stage is where they struggle to find meaning. Where do I fit in all this? Coming back to school, how can I reach out to others? How can I tell my story? I have gone through so much during corona. Maybe I haven't done as many things as I hoped to do, but this is a season I can do that. So how can they seek out emotional support? This is the time where now as a teenager, you need, if you're going through adjustment issues, you reach out to a teacher, you reach out to a counselor, you reach out to a peer counselor as well, that might work, or friends, or reach out to your parents just to get the emotional support you need during the bargaining stage. Then we move on to the depression stage, and this is the one that usually worries us the most. This is where someone becomes completely overwhelmed or feels helpless or loses hope or is feeling hostile or wants to run away from whatever the issue at hand is. So this would be the best time then as a parent to offer guidance and direction. When you begin to see the deep in emotions, where you begin to feel the sense of hopelessness in your child, that's the time, that's not the time to tell them, man up. If it's a guy or as a girl in this family, we don't do this. Can you stop being a baby? Those are not encouraging statements. Instead, this is the point you say, you acknowledge and validate their feelings. I'm sorry that you feel this way, but this is what we can do to move forward. I am here for you. I am working. We are in this together. Don't feel like you're alone. And so depression stage is really a stage where as parents we need to guide and direct. And lastly, there's a place of acceptance, and that's where we hope with everything in all transitions that we all get to the place of acceptance, where we are willing to explore the options, put a plan in place, and move on. And that's what even this session is hoping to achieve, to get us to that place of acceptance as teens and as parents. So the next thing we need to consider, usually it's very easy to know when a child is depressed. Maybe they'll withdraw, maybe they'll not act in the normal way that they usually do. But there are signs that we need to look out for that may seem positive, but really are masking other feelings. So maybe suddenly you've gotten a clown. Your teen is all jokes and smiles. Nothing is wrong. They're the ones who are encouraging everyone. Now, that might be a sign that they are finding it difficult to express their pain. And so they are masking their pain being in this veneer or in this face of jokes and smiles. So it's good to, the key here is to not assume that they are okay, but ask, are you actually feeling happy? Is the cracking of jokes okay? Especially if it's a change from the norm. Uh, Again, you might find your teen has now become overly compassionate. They care for others, even up to a point that it's a fault in itself. Then at that point, you need to ask them or clarify whether they feel undeserving of love or whether they feel they are not able to get what they are giving what they hope to receive themselves. Maybe one might become a high achiever suddenly, making goals, setting them, achieving them, and going forward. And those things don't seem negative at all. But sometimes they may begin to feel like imposters. That's why they are chasing after the next goal to be better. So, as I said, the key is not to assume. Just because they are bringing home good grades does not mean everything is okay beneath or within them, beneath that veneer they've put up. So ask away and encourage, set up an encouraging environment for your children to speak up and to say what it is that's actually bothering them. Maybe they become unshakable with the changes. Suddenly, they're the ones, the motivational speakers. Everything they do, they have a quote from a book or you get what I mean. They become the always positive person. Now, there's nothing wrong with that. Again, I say, I'm not saying that if they are joking and smiling or if they are caring for others, it's a bad thing. I'm just saying, don't assume, because sometimes and oftentimes whenever we have cases where we've had suicide, it's that most of their feelings were masked. That's why it's good to look out, to think about the signs to look out for. So if they are unshakable, they might be numb to reality. They are feeding themselves with this notion so that they can stay afloat, because because when they think about the alternative, they cannot envision themselves going through it. So encourage your children. And then the other thing is, even as a parent, you might also become constantly busy. And busyness is a sign of avoidance. You're distracting yourself from your thoughts, from the things that are nagging you about the transition. So if you feel the need to fill every single waking moment with an activity, then stop, pause, and ask, why do I have to keep busy every single moment? Why am I not taking time to reflect? Why am I not taking time to evaluate? And so those are the signs to look out for in case you find that your child, as you're checking whether your child is adjusting properly, your teen is adjusting properly to going back to school. The other thing to look out for, and these ones we hope we don't get there, are addictions. Now, addictions are the unhealthy ways in which your teen or even you as a parent might choose to cope with a transition. And I've divided them in various categories. They are the type of addictions that are feeling addictions, uh, or thought addictions, or activity addictions, substance addictions, and people addictions. So feeling addictions are like holding on to those feelings. You grow a pattern where you're holding on to feelings of anger or of hate or of guilt or envy, fear, or any other negative emotion that then becomes a self-defeating, grows into a self-defeating attitude. There are thoughts, maybe you're obsessing over something, fantasizing, always daydreaming, zoning out in class. That's a sign that maybe you're getting addicted to a thought pattern that's not proper. There might be activities that you're getting addicted to. You've heard of retail therapy, where people start spending as a way to get rid of their negative emotions, or they gamble, or they take to exercise but to an extreme, or take a hobby to an extreme, or they overwork. Those are signs of an addiction. It could be substance abuse, and substance abuse doesn't just mean alcohol and drugs. It might be food as well. I think I believe Dr. Kathy covered this, where you turn to food either as a comfort, or you turn away from food. Either way, that's an addiction. And then there's people, maybe you turn to having sex as a way to cope, or to join in a gang, or to become dependent on other people so that they feel like you're clutching to them with everything that you have. So those are the type of addictions that we need to look out for. And again, this is the extreme cases. Thankfully, for most of us, we adjust quite well. But in case you get to this point, please seek help. Don't be afraid to say, you know what, I am here and this is what I am so angry, and I don't understand why I feel the need to bash things. I don't understand why suddenly food has become my comfort. I need help. And it's okay to reach out to a mental health expert, whether it's in your school, or to reach out to a teacher and tell them what you're going through, or reach out to your parent and get the help that you need as a teenager, or even as a parent. Sometimes we ignore. When children go back to school, we experience a lot of emotions ourselves as parents. And in that season, when you have nothing, maybe you paid everything for school fees and you're left alone in the house, and these things also pop up. So it's okay, whether you're a parent or a teenager, to seek help. It's not, look at mental health just like physical health. When you're sick, you go to a hospital. In the same way, when you're mentally distressed, visit a therapist or a counselor or someone who can help. So then how can you transition in a healthy way? So as parents, set boundaries both at home and at work, again, towards your time with your children. As children, set your boundaries at home and at school so that you can accommodate the transition. Whether you're day scholars or boarders, it's okay to set your new boundaries. Maybe things won't be the same. Maybe you'll say, I know I like to read a lot, but I also need to take time out. In this season, you've realized you have a hobby. So maybe you're going to set a boundary that at school, I'll have 1 hour to pursue my hobby or to exercise. It's okay to do so. It's okay to say, I don't know everything and I don't have all the answers, whether you're a teen or you're a parent. Admit, I don't always have all the answers. Even as a therapist, I don't have all the answers. So normalize not knowing, and where you don't know, it's okay to seek help and to ask others and to find resources that support you. Take time to eat well. I think we've been told by the nutritionist, get enough exercise and rest. I think as well, Dr. Juma has alluded to that. Be anxious about reflecting on your thoughts, actions, and feelings towards yourself and towards others. I think Michelle has pointed to that out. Why are you acting out the way you are? Might you be doing some things that might be putting someone else at harm? So be proactive as well about solving problems that may arise. Now, as a parent, how do you help your teen to transition? I think it's important, even before they go back, for those who are boarders and even for the scholars, to spend quality time with your children. Set time to spend with your, as a father with your son, as a father with your daughter, as a mother with your son, as a mother with your daughter. And you can do this before they transition, and even as they come home, take time out, not just to go and ask about grades in school or where with the teacher, to also know are there behaviors that you need to be aware of that have cropped. Whatever cultures you have adopted in this corona time, maybe during corona you are doing house chores together, maybe you've started doing a hobby together. Please maintain this. Have some that are routine and some that are spontaneous. Talk about your feelings as well, so that your teens can also learn to share their worries and fears with you. I know with teenagers, as parents, a lot of times we are scared to share, but it's okay to share with them. It's okay to let them know that you don't have all the answers. It's okay to tell them, I'm also scared about this. They'll appreciate you more and see you as more approachable than maybe they might have seen you in the past. And then again, as we talked about in the stages of grief, guide teens to find solutions to their problems by asking questions gently. Don't impose. Again, they're trying to get autonomy. So as parents, and they're still seeking their identity. So don't rubber stamp what they say, but neither don't give too much leeway, but as well don't dictate everything. Have a conversation. You'll be shocked at some of the solutions they come up with, even as teenagers, and you'll have encouraged them to become problem solvers. Again, praise effort when they experience failure or disappointment. They may not always get the results that you want, but if they have made an effort and given it their best, then it's really important that you praise the effort, whether or not they came or they succeeded or not. So lastly, last but not least, what is the godly perspective on transitions? Even as you're thinking about going back to school, remember Deuteronomy chapter 31, verse 8. The Lord himself goes before you and will be with you. He will never leave you nor forsake you. Do not be afraid, do not be discouraged. Dear teen, remember that God goes before you. He is with you right here, right now. He'll be with you in school. He'll not leave. Even if all of us are not available, you can always whisper a prayer, talk to God, engage with him, tell him how you feel. Remember to read the Psalms. Sometimes the Psalms have been very calming to people going through various mental distress. And please don't be scared to reach out. And last but not least, Philippians chapter 4, verse 6 to 7. Don't be anxious about anything, but in every situation, by prayer and petition with thanksgiving, present your request to God, and the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus. I hope you've taken home something, and even as we conclude, I'll say it once more. Transitions are hard. The brain is wired to seek normalcy, to seek the familiar, but with the proper guidelines, and I like that you're preparing beforehand for the transition, we can do it, and it can be a very enjoyable time. Again, if you get to the point you don't have all the answers, it's okay to seek help. So thank you and God bless.
Thank you so much, Kezia, for that very sobering talk. I'm sure we have gained a lot, and I have a question even towards that. Yeah, but before you answer the question, I will welcome Mrs. Ekai. She's one of the teachers in one of the private schools. At least she has had an experience with the Form 4s at school, and she'll just briefly, probably just encourage us and reassure us as parents that the schools are well prepared and what exactly has worked for them so far. Is there a certain behavior in children that has worked? Is there one that has not worked? I welcome Mrs. Ekai. Are you around? I believe you are somewhere. You're here. Welcome.
Yes, I'm there.
Thank you so much.
Thank you very much, Dr. Kihara. Good evening, everyone. I'm sorry I joined late, and I'm sure I've missed a lot, but I'll follow it up on YouTube. Now, I would like to answer a question which was posted to me earlier on the measures being taken or which have been taken, which have worked in schools. One thing I would like to assure the parents and the students is that in school, people are well prepared. Schools have put in place the measures which the Ministry of Health put across for schools to put across so that students are safe in school. So the protocols are being followed in school. There are enough sanitizing places, there are enough hand washing places with soap and water, and it has worked. In most of our schools, we have had people washing hands and sanitizing every now and then. And unlike even the past where people would in schools, there has not been any cough this time, we thank God, thanks to the measures which people have taken in schools. So the schools are prepared to receive the students back, and they have put in place enough places for hand washing and sanitizing. There is also the sensitization bit where the students will be taken through, because there is change, then it's the new normal. We refer to it as the new normal. So the new normal is not what usually goes on in our schools. This is something new. So once students report to school, they are being taken through some sensitization by professionals, by doctors who are there full time in most of our schools. And then these measures during the time or when the Form 4s were there in schools, at least with the sensitization, they are being taken through every step, how they are supposed to behave. The mask, you are supposed to wear your mask every time to mask up, and it has helped a lot. Once you mask up, it's only when you are eating when you remove your mask, and immediately after that you put it on. And it has worked for most of us. So the students will be aware of what they are supposed to do. Of course, they are supposed to know there is no handshaking. Those who used to hug, they will no longer hug. And we thank God because with the Form 4s, they followed. We saw them following. And teachers are also up to the task to ensure that students are safe, and also themselves, they are safe. So once students are sensitized on everything, because of course, there is the general scare of the COVID-19, and because of that scare, I want to take it to say as a teacher, it's a positive thing, because once you are scared, you tend to follow the rules to the letter. So once everybody else follows the rules, then we are all safe. So that is the short presentation I have. I want to reassure parents and students who are going back to schools that schools are ready to receive them. They should not fear. There is enough space for social distancing. There is enough hand washing and sanitizing points in school. You might not even need to carry a whole sanitizer, you know. There are people who want to carry like several sanitizers. You don't need that. There are enough washing points with soap and water and sanitizers at some specific points, all around the schools. So I want to reassure you that you will be safe. And with our trust in God, of course, God is our protector and he protects us from everything. So with all that, we are sure that with God, we will be fine come next year when we begin on 4th. Thank you so much, Dr. Kihara. Back to you.
Thank you, Mrs. Ekai. Probably you could answer this question. How can we make schools more accountable on psychosocial support post-COVID?
Maybe the person who asked that question could elaborate it more, because in schools they have a committee. They have a COVID-19 response committee team. In our schools, there is such a team where should such a case arise, they handle it very professionally. And in this team, there is always a doctor in all the schools. So as it moves, there is a way, there is a protocol of doing things. And of course, the parent will be notified. Of course, the parent will be informed immediately. You know, once the samples are taken and the student is positive, they will be told. Even before that, maybe. Even when the student is on isolation, the parent will be notified by the doctor. So there is a committee in every school who have the mandate to deal with such issues once they arise. And the parent is always notified at every point. I hope I've answered your question.
Yes, yes. Thank you very much for that answer. Yes, I think the students, they should know that they have the guidance and counseling teacher, and they shouldn't shy of going to the teacher and to at least ask a question or just relay their fears. I think this is the time when for the whole community, just be nice to one another and let's help one another. Yeah, so we are about to end. Thank you so much for your patience, the participants who are still with us. Thank you so much. There's one more question that will be answered by Ms. Kezia. Now, this is someone who asked, if my child is not ready to go to school, and the child just bursts into tears when they hear about going to school and they feel like they're not getting anything from school. Ms. Kezia, how do you help such a child?
Thank you, Dr. Kihara, and thank you to the parent who has asked that. I would like to say, sometimes when you see such a reaction, there may be deeper underlying issues. Maybe learning disorder, and that's why they're finding it hard to get anything from school. Maybe they suffered a traumatic event at the school. It could be a case of or any other vice that has caused them then not to find the school as a conducive environment for learning. Or it could also be that there's a special need that has not yet
Kezia, we have lost you.
Sorry, my apologies about that. Sorry. So I don't know what the last thing you had was. Or let me just start again. So I was saying, in the case of that parent, thank you for asking the question. It's actually really important. So there could be several scenarios playing out with your child. One, it could be your child has a learning disorder, and that's why they are not able to grasp anything in class. Two, it could be that your child has suffered a traumatic event at school, which has then made the school not a conducive environment for them to learn. Or three, and this traumatic event might be a case of bullying or of homosexuality or any other vice that has taken place, or maybe drug abuse that maybe they don't like, but you get could be any form of traumatic event. And third, it might be a special needs area or that has not yet been identified. So I would advise that parent, if possible, to at least have a few sessions with a therapist and a child before school starts, just to be sure that they are not taking their child back to an environment that will cause them harm. You could also try to get it from the children themselves, but if you find that they've hit a wall, please seek help. You might find very surprising things. So please seek help.
Thank you, Kezia, for that. I believe that the teachers have been trained at least to be able to welcome back the students to school and to incorporate their experiences in the normal learning schedule. And somebody comments about children who have gone through gender-based violence. I believe the counseling department should be able to help that, but at the same time, the child has to volunteer to be helped, or maybe the parents have to notify the school what their child is going through. But before that, in the coming few days, you can see a child therapist or a child psychologist or a child psychiatrist just to get helped. Yes, Lauren, your hand is up. You're welcome to make your comment. Okay, I can't hear anything from Lauren. Somebody had asked about the day scholars. Dr. Mondi, kindly make a comment. How do they protect themselves? And they are always moving from home to school and probably using public transport.
Okay, what I would say is that just as we had talked about the various protocols and guidelines for ensuring reduced transmission of infection, the day scholars should still continue observing the same while they're at home and during their transport to school. So even before a day scholar leaves home to go to school, first they should do what we call self-screening. So they should find out if they have any signs and symptoms of disease. Of course, if one is sick, then that is a reason to stay home or go to hospital. And once they're they're on transit to school, of course, there should be a reliable means of transport where we ensure that the protocols and the guidelines are observed. So of course, there should be use of sanitizers before getting on board. They should wash their hands before getting on board and properly wear their masks while on transit. And whoever is transporting them, the drivers, or even the people who act as conductors of the means of transport, should also observe the protocols.
Thank you, Dr. Mondi. And now to the audience, is there someone who has a...
Hello?
Yes?
Can I continue?
Yes.
Okay, I was saying that before the day scholar gets to the school, at the gates, usually we have screening points where temperatures are taken. Of course, if one is found to have symptoms of disease, then they would either be isolated or sent back home to seek medical care. The school should also avoid crowding at the points of entry and exit, so that once when there should be gradual entrance into the school, the gate should actually not be crowded. They should ensure social distancing during entrance into the schools. And then the other thing we can say is that generally the student population, when they look at the student population in Kenya, most schools are day schools actually. So it's secondaries. For the secondary population, 70% are actually the scholars, and 90% are primary school. 90% of primary school goers are actually the scholars. So this has been found to be actually a weak link in the fight and the prevention of spread of COVID-19. So we need actually to tighten the observance of these protocols when we are releasing the learners to go to school, so that they don't pose a risk to the people who are in school, that is the staff and even the students who are boarders. Back to you, Kihara.
Thank you, Dr. Modi, for that. We are doing well and we are about to finish. So my question was to the audience. I'm going to give them this opportunity in case there's somebody who wants to make a comment. They're welcome, or a question.
Before that, Dr. Kihara, there's a question that had been asked and I would like to answer.
Okay.
Someone had asked, what of counseling children who have gone through gender-based violence? So in response to what the teacher, Susan, had said, that there are committees and protocols. So I would like to say a lot of schools, as we said, are connected to certain hospitals. And in hospitals, you'll find someone who is able to deal with gender-based violence cases in regard to counseling. So in case you're releasing them to school and they've not yet gotten the support they need, it's something you could divulge to the school nurse or the guidance and counseling teacher, and they are able to refer to a professional based with the school that's connected. And there are some that actually have school counselors on board. So like professional counselors who are not necessarily teachers in the school. So if that's the case, then your child will be in good hands. So just make sure at least either the school nurse or the guidance and counseling teacher is aware of what has happened and knows how to handle the case.
Okay. Okay, I will welcome Ms. Felista Kimotho to make a comment. And before that, the students who are here, there's something new about having a bubble of friends. This is something that at least would help one in reducing the contact with so many other people. Just have a bubble of friends that you are keeping to, that you are interacting with. Let's not interact with everybody else in school, but have a bubble of friends or a bubble just of students that we are with, just to reduce the contact with many other people. Miss Felista?
Hello, can you hear
Miss
me?
Felista is a Miss. Yes, I can hear you.
So, okay, let me do the introduction.
Miss Felista.
Oh, it's okay. You can go ahead. I think I have some poor internet connection, but you can do the introduction.
Okay, Ms. Kimotho is a student in one of the tertiary institutions, and she's a Miss Tourism in Nyandarua, and she had a message for the students. You're welcome. Just a few seconds.
No problem. So I am a mental health advocate as well, and the founder of Mental Farm community-based organization, where we deal with creating awareness on mental wellness as well as advocating for the rights of persons with neurodevelopmental disorders. So my message to the students and everyone is basically, I think we've learned a lot from the whole webinar and stuff. It was amazing because they have tackled a lot of cases, okay, current emerging issues. And what I can add is that depression is a disease like any other. It can be treated for as long as you speak up. And make sure as a student, you talk to your friends. Again, make sure you get to things like, you get to appreciate time like breaks in classes, exercise, and you have to improve, okay, to have a good mental wellness. Again, have good friends in school. Take care. Personally, I am a young girl and I finished high school 2 years ago. And so I know how it is currently. So make sure you have good friends, and also as parents, be there for your children, because I can say out of experience, as a mental health advocate, in the society, I've met children who are complaining that one day I went through depression, and what I mentioned to my parents maybe that they wanted to kill themselves. And what the parents said is that unataka nikuletee panga, like you want me to bring for you a panga or things, like because they are taking it like something so light. So even with your friends in school, make sure you share your stories and be open with one another. Yeah, thank you. Back to you, Makini.
Thank you, Miss Felista. Yeah, for those are encouraging words. I still have one more chance to the participants if somebody wants to make a comment.
Dr. Kihara, I have been asked to share exact things that teenagers can do to cope with anxiety. So I'd like to share a few of those.
Miss Kezia, okay.
Can you hear me? Okay.
Yes.
So I was saying a few things to do. So if you're feeling anxious, there are breathing techniques. I know it sounds very simple, but sometimes just breathing in and out can calm you down. So make sure that you breathe in and breathe out, counting backwards, so that your mind is engaged in the counting. That should help. Try holding your breath so that you calm down until your heartbeat and your breathing rate are back to normal. If you're also anxious, it means there is a thought that you need to replace. So whatever it is that's bringing anxiety, say you're telling yourself, I can't do this, I can't do this, I can't do this. You need to start voicing it out so that the voice you're speaking is louder than the voice in your mind, so you can begin to do positive self-talk, like I can do all things through Christ, or I can do this, to counter the negative thoughts that you have. And you could also tell a friend about what you're experiencing so that you can hear it from someone else's perspective. Whatever you're anxious about, you get a new perspective about it. Remember, anxiety is just one of the perspectives. So it's okay to share with somebody else. Remember as well to pray about it. It sounds simple, but God has a peace that surpasses all understanding, that guards your heart and mind. So please speak to Him. And in case you need further, like you have a panic attack, there are other things we can do. But because I'm not sure to what level of anxiety I'm speaking about, those are a few pointers that you can use.
Okay, thank you. Thank you, Madam Kezia. I feel I don't want to end this meeting without mentioning that as parents, let us give our children enough supplies, something like stationery, so that they don't have to share with other children. And to the students, just have your own stationeries and your books, so you don't have to share, but where you have to share, then you have to sanitize. So one can have at least a resealable bag that you can carry around where you put your mask, because the handling of mask, touching mask all the time, it means you can actually infect yourself through touching the mask all the time. But if you have something like maybe an envelope or a resealable bag where you can put the mask when you are eating or when you're doing something else, that would be good, so that you don't end up touching the mask and infecting yourself. The other thing is to carry at least more than one mask, because one may fall and you don't want to pick it from the floor, and probably you could have those viruses on the floor, then you wear it. Just have to, so that if one gets dirty, then you can throw it and take another mask. So avoid the sharing of items where it is possible. Yes, and just take care of yourself. We have talked about at least eating well. The other thing is sleeping well. As students, mostly maybe you want to work very hard, but remember that you have to sleep well. That helps boost your immunity. There's that time when the teachers ask you to go for exercise and to run around. That's not the time to make yourself busy, maybe like prefects and do something else. Just make sure that you run, because the exercising bit is also part of building your immunity. And with that, we'll come to an end, unless if there is any burning query from the participants. I thank everybody who has been involved in organizing this meeting. May God bless you so much. You have volunteered, yes, and you have given the knowledge for free. Thank you so much. May God bless you. And for us who have received the good messages, let us spread it out there. So we have been live on YouTube, and I had sent the link so we can open and access these presentations later, especially for that student who was making notes, can be able to make your notes again using the presentations that are on YouTube. And I thank everybody else. I also thank my family. They have helped me a lot prepare for this. Thank you so much. So thanks to Eva. She's been part of our administration. Thanks to our psychologist, Kezia. Thanks to our pediatrician, that is Dr. Mondi, and to our nutrition expert, Dr. Catherine, and to all participants who have joined us. Thank you so much, and may God bless you. Wishing you all a happy new year 2021 and a great time in school. Let's continue in prayer. We trust God that He will see us through. At least we've seen Him blessing Africa and making sure that the cases are well manageable. So Dr. Catherine is going to pray for us as we end this meeting. Thank you.
Okay, let us pray. Almighty God, in the name of Jesus Christ, we come before your presence tonight. We thank you for that opportunity that you gave to us to share thoughts that are helpful to us as parents, as high schoolers who are going back to school. We thank you for the information that we have gathered this evening. We pray that it will be helpful to each of us. We thank you, dear Lord, even for all the parents that are represented in this meeting. We speak a blessing upon each one of them. We pray for good health. We pray that, Lord, you will give them the wisdom they need even to be able to be the mentors of their children. Thank you for the high schoolers in this evening meeting. We are grateful for each one of them. And even as they prepare to go back to school, we commit them to you. Thank you that you have preserved them this far. And even for the days coming, and even when they're in school, we commit them to you for your divine protection, dear Father, for understanding and wisdom that comes from you. Dear Lord, we pray that they will experience you in a new way, Jehovah God. We thank you because you are good, God. We thank you because you care for us. Tonight, as we depart, we pray that you may give each one of us a restful night. For it is in Jesus' name that we pray, believing and trusting. Amen.
Amen. Amen. Sorry, there's a question about chemistry labs, whether one would recommend the removal of masks. You know, masks are supposed to be used, especially where you can't afford the social distance. But Dr. Modi, maybe you can say something about it. And of course, the windows should be open. Dr. Modi, or any teacher who is around, who is in the meeting, who would want to make a comment.
Dr. Kihara?
Yes.
Okay, I would like to make a comment on that, because we have been having students, and the chemistry lab is just like a classroom. And in class, we encourage students to mask up. They should not remove their masks because there are many of them in the same room. Much as we'll open the windows of the chemistry lab, we would still encourage them to put on their masks. Thank you.
Okay, thank you. Thank you for that. And I think it will also depend if whatever is being done. Maybe if it's a case now where we have these gases that could be harmful, then the teacher will decide what needs to be done. Thank you. I think we can go on and on, but we have to end this meeting. And thanks to everybody who has participated. May God bless you. Have a good time. Thank you. And bye.
Thank you, Kwaheri.
Thank you and bye.
Bye. It's time to say bye.
Participants
69.
The mom is